Entrepreneur, author, and financial consultant Mark Bernstein helps high-performing entrepreneurial business owners create a vision for the future and follow through on their goals and intentions. Ange Honorato is a business growth strategist who blends psychology and business together to create conscious leaders and business owners who impact the world. Founders Forum is a radio show podcast sharing the real stories behind entrepreneurship as founders discover more about themselves while providing valuable lessons and some fun and entertainment for you. Now, here's Mark and Ange.
Good morning, America. It's sunny in Philadelphia, as not always today, and it's going to be a real hot day in Philadelphia. But wherever you are, hope you're having a great day so far. We have an exciting program this morning. And before we do that, and we'll involve our guest in our thought for the day, but I had an experience which was completed this morning in regard to a medical office. And I'm sure people have shared similar experiences, but real quickly what happened was I had follow-up to a surgery last year, and I got a call the other day that I thought was confirming the appointment, and they said, no, we're actually changing your appointment. You're not going to see the doctor. And I said, oh, why is that? And they said, well, because you haven't shown up for several appointments and he's decided he's not going to see you and you're going to see his PA instead. And I said, really? And I got really mad and I used words I shouldn't have used, and I haven't done anything like that in a long time. And because what they said simply wasn't true. I did miss one appointment that I called in. I had a timing issue, but the others were cancellations by them, except for the last one when I had COVID, which I was pretty sure they didn't want me to come into the medical office when I had COVID. So to say that and make it my fault was a bit offensive. I've had the last couple of days to think about it, and I was in the office today. It got straightened out. The doctor told me that wasn't true. That's not what happened, and he would be happy to see me. And I went in, and I did see the person, and I didn't get a chance to talk to her about it that used those words to me. And I wanted to apologize to her for blowing up. And I was hoping that she would apologize to me for what she said. But we didn't get to have that conversation because she was too busy to have that conversation. So I started thinking about what it's like to be the patient on my side, what it's like to be the doctor who's really a good guy who his network's changing. His hospital was bought by another network and they're cutting staff and there's all kinds of pressures. What it was like to be those office people who must hear complaints all day long and the pressure they're under. And it's just a complex environment that we enter into every time we go into an office like that. So your thoughts, both of you. We might start with Glenna because she has a lot of experience with healthcare, particularly in the senior networks.
Yeah, we're seeing more and more of this today. I think the important thing for a patient to do when they're in a situation like you've been in is to distinguish between the quality of care and the interaction you had with the clinician themselves versus what happened with all of the staff. When we do network mapping, for example, we don't just look at the physicians or the dentist or so on that people engage with, but also the appointment clerk and the receptionist and the nurse and the billing clerk, because all of those are the sum total of the experience. That's the patient's total journey, the total experience in that setting. And if those other people are surly, insulting, unwelcoming, that can make some people less likely to seek care. And that's not what we want for patients. We want them to feel comfortable and welcomed so that when they need the help that only a physician can give them, that patients reach out and show up.
I just want to mention, thinking about what you talk about, I interacted in 15 minutes with 5 different people there, plus a phone call I made to them before that, which I'm used to, the buttons, the options you have to push and all that to get through. When I first pushed the first button, and I did this 3 times, it said, sorry, our networks are busy. The phone wouldn't even go through. So if you count that, it was like 3 other people with the phone calls I made. So it was like 8 interactions, basically in a half an hour period before the 5 minutes I got there and by the time I got out of there. So I think that's a really great distinction, and I know it will help me mentally and spiritually going forward when I'm dealing with these issues.
Yeah, I think it's a very multifaceted problem because you've got let's call it the customer experience. Mark, you as the patient, Glenna, to your point, it's mapping it out and looking at the systemic problem, all the touch points and making sure that's leading to a good experience. But I think what happens, having a lot of family in the healthcare and the provider services as well, I think, they're dealing with so much burnout right now. I think there's service burnout. I think there's, for all of those things that you're talking about, Mark, I think when you're in a staffing role inside a healthcare practice even, you hear this about dentists all the time, right? They're like statistically the highest, most depressed profession in the world are dentists because so many people are scared to death to go to a dentist, and they put themselves there every single day dealing with people that don't really not like them. They just don't like being there. And so it's a really, really unpleasant experience. And so I think there's a thing there with the providers themselves are dealing with people that don't feel well and they're not happy. And it's just it's a pretty cyclical issue. I think there's a lot of tentacles that go into it.
They say that about postal workers too. There's always that expression going postal.
That's a real thing.
And I had a family member who worked for the post office who died young, and I always wondered. But think about how unhappy postal customers are a lot of the time, and what that must do to them as well. So anyway, let's reintroduce our guest today, Glenna Crooks. We liked her so much, enjoyed her so much the last time that we had her back for part 2, and I will just tell you this. Glenna Crooks is the network sage coach. And when we last talked, we talked about the fact that everyone in their lives has 2 major networks. We talked about longevity networks. We talked about the use of human capital. We talked about longevity pioneering. We covered a lot of ground in a short period of time. But today we had Glenna back to talk about what she's really up to now and what she's most interested in. So, Glenna, if you would just do us a favor for those that didn't hear the last show, give a brief synopsis of your life and how you got to this place, and then move into what you're talking about today, and we can go from there.
Sure. Well, I'm in my 8th career. I think I got one more left in me, but I got to succeed at this one first, so that's where I'm focused.
I have a feeling you might have more than one, but that's another story.
Yeah, there's more energy there. I wish we could bottle it.
The early part of my career, I was a school psychologist and an innovator, actually, in that phase. I was trained to be an innovator. I have an interdisciplinary PhD in the health sciences, the social sciences, law, and journalism, but I always add right away, I am not a doctor, and I am not a lawyer. I am uniquely qualified to do nothing except what I do. And what I do is to organize chaos and solve complicated problems. I started out doing that in education, and then I moved over to healthcare. And in the health space, have been in the public sector. I was a senior advisor in the Reagan administration appointed by the president to advise on health policy matters, but then also worked in the corporate world. I started the policy operations for Merck here in the U.S. and globalized it eventually, and then became the vice president of Merck's vaccine business globally. I've had my own consulting firm for a number of years, and that's what led to what I'm doing right now. My clients were businesses and governments around the world who had a tough healthcare problem. You know how it is, you work a long day with somebody, you have a long dinner that night, they have their second glass of wine, they start letting their hair down. That's when I heard how burned out they were and how they wanted to quit.
And you were working in high-level organizations, large high-level organizations with high-level people that were pretty much at the top of the chaos, I guess, to a certain extent.
Including CEOs. I would give speeches, and after the crowds cleared, one would pull up a chair in front of me and sit and cry, worried about whether they were going to be able to keep the company going and what would happen to the patients they were trying to take care of and the employees that they had hired and so on. So I thought, what a waste if these really talented people leave. They were committed to doing good things in the world. So I went looking for a solution, and I eventually found one from Robert Downey Jr., an unlikely person in a fashion magazine, An Unlikely Place. So that's when he said he had a pit crew of people helping him out, a yoga teacher, a sensei, a psychiatrist. But I need one, he said. I'm not a Model T, I'm a Ferrari. And it takes more of a pit crew to keep us on the road. And I thought to myself, I must have been in a snarky mood that day. Buster, if you're a Ferrari, I'm at least a Maserati. And you know what? You're right. It takes a pit crew who's mine.
So I've heard this several times, but I will tell you that it actually does make sense that Robert Downey Jr. would be a deliverer of that message.
Yeah.
Think about it.
So I started looking at my own life, and that's when I explored and found these 8, what I call life networks. These are enduring networks. These are people who are with us over a very, very long period of time. I mean, never forever, but over a long, long period of time. And then we have event networks, like the event network you had when you had surgery.
Right.
We studied one of those event networks recently with someone. He was in the hospital for a grand total of 26 hours. In his case, he had a hip replacement. And there were 50 different types of people that he encountered during that event. I mean, you counted the 5 that you experienced in your doctor's office. This was 50 that he encountered in the hospital. So
I'm going to go through that because my own surgery, I'm going to take a look at that, but it's probably similar.
yeah. And other conditions can be even more complicated. Another study we've done on an event network is what a husband had to manage when his wife had stage 4 metastatic breast cancer just in the hospital. And he managed 87 different types of people. I mean, his wife had 23 different types of nurses. I mean, it starts to tell you something about the complexity. Now, here's what I've learned. If those 8 life networks you have, if they're in good shape, then when you have an event, it's going to go easier because you're going to have people who will help you. You're going to have people who have information, people you could turn to and say, hey, I'm looking for a good whatever, a good surgeon, a good florist, a good caterer for my daughter's wedding. I mean, whatever it is, you will have people who can give you information, and you'll have people who can connect you to other people. So maybe you're in a situation and you need to talk to somebody who's been through it. Well, maybe you have a friend who hasn't been through it, but they have a friend who's been through it that they will connect you to. Now, conversely, it goes the other way too. If your event network is really good, then it's going to protect all of your life networks. And here would be the example. If you're a parent with young children and you have a pediatrician who is very responsive and your child gets sick at night, then you're much more likely to get the help you need in the middle of the night, which then is going to make it much more likely you can go to work the next day. Just like if you have childcare. If you have reliable childcare, it's going to be easier for you to go to work during the day. So, though it goes both ways, and understanding, starting with, especially the people in your 8 life networks, is the real place to go. I mean, I feel like I've almost hit the jackpot talking to both of you. I mean, Mark, you're the financial guy. You understand financial capital, and you understand people and humans. And human capital is what I'm all about. Is how do we unleash what is a lot of pent-up human potential? Well, I think it's human capital is the route through that. It's not just our money. It's not just our education that's going to get us to where we want to be. It's the human capital around us, too. That's awfully valuable, and we've not been paying close enough attention to it.
Right. You know, Glenna, we've heard the story of Robert Downey with you before, too, but I think it's a great example because it also shows, if you look at his entire life and his career, he was top of the heap. He was absolutely the bottom of the barrel. And through that pit crew, presumably, it helped, to your point, bring him back to where he is, today, and he reached even higher heights because of having that support system or that pit crew. You talked about the 8 different types of networks, and you're probably going to get into this, but can you give us kind of a highlight of what, for anyone who's not really familiar with even this concept, what does that look like for you when you say 8 different types of, networks?
Before you answer that real quickly, I just want to mention, because you mentioned financial capital in the business I'm in, even in our business, we are looking at how to provide human capital. Think of family offices for very, very wealthy people. They have family offices, so they have all these resources in-house, so that becomes part of their network. There are people that are not as wealthy that have as much complexity that don't have access to that. So we are trying to figure that one out to provide that for people because we see that big need. It's not we recognize that it's not just the financial aspect of it.
Right.
Probably as unconscious competence. We're not super conscious. We don't put it in those terms, but this is helping a lot. This is helping me clarify it in my mind. So let's go back to the 8 networks.
Yeah, the 8. Okay, so I divide the 8 networks into 2 of them. The first 5 I call birthright networks because you were born into them. This is going to make real sense, intuitive sense right away. It really, people get it, and it does make sense. And it is, by the way, verified by the social science literature. So the first network is the family network, right? All right. The second one is your health and vitality network. The third is your education and enrichment network. Fourth is a spiritual network, and fifth is a social and community network. All right, so that makes sense. Mm-hmm. That's, our parents create those networks for us. We start changing them right from the time we're little kids. But the people in them and the function that they serve is something we will need for the remainder of our lives. We never outgrow those needs. They're human needs for connection and support of that type. Then there are 3 that I call coming-of-age networks because we mature into them. The first is a career network, which is where we usually think about networking, but in truth, we're networking everywhere, off the job as well. And then one I call your home and personal affairs network. So your home, what kind of a household do you live in? If you have a home, for example, the number of people you need to help you, protect or improve that property is much larger than if you're renting an apartment where you don't need to do that, okay? And then personal affairs are things like your banker, your car dealer, your attorney, your financial planner, your estate planner, people like that, your accountant for doing your taxes. Finally, you have a network that I call ghosts. Now, I did not go looking for ghosts, but they kept showing up. Ghosts are people who used to be in your life who aren't any longer. And they're important for a couple of reasons. One of the things we know is that everyone who comes into our life, even for a brief moment, can have a profound impact on us. I'll tell you a story, a good story about that in just a moment. Now, some of them impact us for better and others not.
Can we halt on that for 1 minute for a commercial break? And we'll go back to ghosts.
Establishing a self-directed Roth IRA or other self-directed retirement plan offers access to investment options usually only available to well-connected or wealthy individuals. Anyone can build wealth and achieve tax-free income for life and financial freedom without the inordinate risk of speculative investing, securities trading, exotic financial instruments, or hoping for the best from the stock market. Since their inception in 2003, Camaplan has come to be synonymous with expertise, flexibility, responsiveness, and diversity of investment choices. They provide innovative investment opportunities for investors seeking direct control and more choices in how they deploy their investment capital. Camaplan doesn't just make it possible to invest in alternative assets, they also teach investors how to put their money to work. Take the road to financial freedom today. Go to camaplan.com/IRA.
We are back, and we're talking to Glenna Crooks about your 8 life networks, and in particular, the last category of ghosts.
Yeah. So the 2 categories that emerged first were some I call friendly and some I call hungry. So the friendly ghosts are the ones who loved you and you knew it. For me, it was a paternal grandfather. Yeah, he died when I was 4. I don't actually remember what he looks like except for family photos. I will never forget how wonderful it was to sit in his lap. And when I'm having a bad day, he's the one I should think about, for some people, it's a pet even. We now know children are more likely to confide in their pet than they are in their siblings when they're upset. But unfortunately, when I'm having a bad day, it's the other ones who show up. I call them hungry. Hungry because you could not satisfy them then. And you can't satisfy them now. They're the kinds of people who left you with a bruise or a hole in your heart. Now, you're still trying to satisfy them, though. Now, not with them, because they're not here, but with people or in situations that remind you of them. We've all had those times when suddenly out of the blue we react to something and we think, where did that come from? That was probably a hungry ghost.
I just have to tell you, my grandfather, as soon as you said your grandfather, I was thinking about him yesterday. Almost every day when I fold my handkerchief, which he taught me how to do, and when I fold my money and organize my money, which may, as I think about it, because he's very deliberate about how your money should be organized, probably has something to do with what I do in my life. And the other thing is, as a new dog owner, my dog is my best therapist. I talk to him every day when we're walking, so I completely connect with what you're saying.
And Glenna, real quick, it's interesting that you refer to them as hungry ghosts, because what I'm brought to is, if you're familiar, Dr. Gabor Mate is considered, one of the world-renowned experts on trauma and addiction healing, and his number one bestseller is In the Realm of Hungry Ghosts. And I think it really speaks to the fact that we're always striving and we're living with these entities, or just the ideas of things around us that do influence our lives. So I think it's really important and interesting that you've included them in your, sort of the life network, because people don't necessarily think about the unseen things that influence our lives. So that's really interesting.
So we only have about 7 or 8 minutes left. So I want to make sure to get to what your focus is today. And I know you have a thought, which is really what I understand is unleashing human potential through human capital. So finish your thought, if you would, Glenna, and then let's get into that deep if we can.
Well, the ghosts are here and hungry ghosts are here because people mention them. All of the work that I have done has come from people. This is based on deep ethnographic research. I didn't make this up. People talk to me about it. The work I'm doing right now is to help people see all that. Sometimes it's because I've written about it in a book or a blog. Sometimes because I've done a show like this, or I just finished a group coaching program for seniors who want to build the networks that they need to live more independently and have more control over their lives. I also do consulting, and I do research in specific topics where these networks might matter. That's my goal. My goal is to help people see their own data. I mean, I'm going to come back to you, Mark. Imagine that you had no way of keeping track of people's money. No spreadsheets, no QuickBooks, no programs, nothing that would help you run a scenario. That's exactly where we are right now with human capital. And what I know is that even a 7-year-old can do this. And even a 7-year-old, when they see their own data, starts making deliberate choices about the life they want to live in a better way. Who do they want or not want to be with, for example? Now, for my own self, I mean, as a business person, of course, I have been taught to delegate. But until I sat down and really looked at my own networks and started to do this own work on myself, which was the first step here, once I read that Robert Downey Jr. quote, that's when I started seeing that there was a whole lot of my personal life I could delegate that I never thought about. So that list of all the things I could delegate became a job description for somebody that I called a nanny. And I hired somebody to help me out just a couple hours a week. But oh my goodness, did it make a difference? It gave me the entire day in the garden, which is where I do my best thinking. So it was really good for my career. No surprise, my income went up. And I had more time for my health and my friends and so on by doing that. So what my work is helping people understand this, what it might mean in their unique circumstances in their life, and then arming them with the tool that they will have going forward in the future. Because once you get the basics, I know more stories than other people because I've talked to more people, but once you get the basics, you have a tool you didn't have before to really look deeply into your life and to make decisions.
That's great. So where do you go from here? What is your thought about how we unleash? I mean, you've talked about it a little bit, but how do you? I know you talk about networks. You're coaching about networks. How do you see this happening?
If I could write the perfect next chapter, I would meet the CEO of a company that really appreciates data, and we would take the design of the app that I have, which allows people to gather this information in about 20 minutes, and we would operationalize that platform. Then, while protecting privacy, of course, we would use de-identified data that it will collect to start looking at the patterns, to ask AI to help us, to understand and advise people more deeply on things that they should consider doing in their lives. I mean, I can do some of that right now. I already know that every person I sit down to talk with is lacking 3 important people in their lives. And within an hour, I can help find them. What I also know is that...
Why do you know it's 3?
Because of the research I've done with close to 1,000 people over the last 15 years. And I know, and in addition to that, what I also know is they have far more support than they know. It's hiding in plain sight. So the exercise is not only gratifying and reassures them that they will be able to accomplish whatever it is they're setting out to do, but it makes them grateful to all of the others. They start understanding that we're not truly dependent, we're not truly independent, we're interdependent. These people have been giving and receiving with the person that I'm talking to, and it's a whole nother level of awareness for moving forward in the future.
You just gave me an idea of someone we should talk to, so we'll talk offline. If you were to, I don't think we had time to talk about any of these things, but if you could speak to your younger self, what advice would you give you today?
Wow.
Because you've had 8 careers, it's hard to pick, one, right, to go back to.
Yeah, I would say, however good you think you have it today, tomorrow is going to be better.
That's great. I love that.
Because that's what I would say about my whole life. The farther I've gone, the better it's gotten.
And you're a reader and a writer. Do you have a favorite book or a favorite author that you could discuss, that you could recommend to people?
Right now I'm reading a book that was a gift from someone, and I wish I could remember who. I'd like to thank them. It's called The Ghost of Harvard. And it is such a mystery. I am so engrossed. Other than that, I would say that I really like Anne Rice's Vampire trilogy, I think it is. Mm-hmm. I read at night in bed, and there will be times, the way that vampires sort of mesmerize you. Her writing does that.
Yeah,
and there'll be times I think, I can't look up from this book. He's in the room. He's in the room. And that's a real skill.
So she was writing on the right subject. It
right.
Sounds like she was attracted to what she does best. So I think that's it for today's show. And Glenna, always a pleasure. So great to have you here. And we will see you all next week on Founders Forum. Thanks for being here.